Okay, you guys have a response. Okay, there it is. So my name is Trina, and like Haley said, this is Stephanie. We are at Tarleton State University, which is in Central Texas. So we've been kind of chatting with everybody about where we are. We are close to Fort Worth, so that's probably all the information that you need to have. I am an assistant professor in the Department of Psychological Sciences. My training is more in cognition and experimental. I'm not a clinical person. And then Stephanie, as she'll talk about a little bit later, is clinical and school psychologist. So I can do this. There we go. Okay, so in this session, we're going to talk a little bit about what community-based participatory research is, just so that you'll kind of get an idea of where we're coming from. We're going to talk about the methods and findings that we had during the first phase of our study, and then what kinds of hopes we have for community-specific resources and future directions as we go forward. And then, as Haley mentioned, we will be around for Q&A, but that will be bumped towards the end.
So as Trina mentioned, I am a clinical psychologist and a school psychologist. So my role in this is a little bit more sort of the translational portion and also developing resources. So I'm going to be more of a back end person. She's more of the researcher. But some of the principles of community-based participatory. Community-based participatory research is a model that's really focused on partnering with the community instead of doing research on a community. And CBPR, the abbreviation, we really try to partner equally, right? And so in doing so, we have created the next phase of our research in part. She is bringing to us questions, concerns, ideas, things that we need to be thinking about and considering that come from the community so that we are responsive to all of the needs that you all have. And so CBPR, it has 9 principles. Well, the primary one that I want to focus on is that this is an iterative process, right? So in CBPR, we get feedback from you all. You all tell us what you are interested in learning more about. We do research on that, and then we give that information back to you. We develop interventions in partnership with the community, resources in partnership with the community. Then we evaluate how that's going, and then the process starts again, right? So CBPR is intended to be something that's ongoing and equal partnership. And that's really the underpinning for everything that we're doing. So we have just sort of completed data collection for phase 1. We are working on data collection for phase 2. We've met with some of you lovely families already. We have appointments with others later on in the weekend. We're collecting additional data, and we're going to be rolling that information out to you all through your community resources, but then also publishing so that other professionals, other researchers can also access that information. So it's intended to be a two-way street. And it's a reciprocal exchange. So I will go ahead and, because we are going to be brief, turn it over to Trina to share with you the results of the initial phase of research, and then we'll talk very briefly about phase 2 and what that's going to look like.
Okay, we can skip this one. All right, so our initial measures were selected based on the interest that we heard from the community in what the experience is of parenting kids in the SETBP1 community. So we selected some scales that we thought would answer the questions we had about that. And those include the parental stress scale, parenting sense of competence, and the dialectical behavior therapy ways of coping checklist. So many of you completed all of these over the last year or so. So we really appreciate you doing that and sharing your experience with us. And then we also had some open-ended questions. So you may have described your child with a SETBP1 difference in your own words, and you may have provided anything else that you wanted to see emerge from the research. So we asked those as well. Go ahead. And so The way that we have been recruiting participants, and we will continue to do so, is we obviously do what we need to do on our end in the university to get everything approved. And then we really depend on Haley and SETBP1 Society to get that out. So that is the conduit for recruitment. If you want to participate and you're not hearing from us, then we need to get in touch with Haley and make sure that you're looped in. So 54 parents participated in our study over the last year. The mean age was 43. 33 were from the SETBP1 community. 21 were recruited for comparison. We recruited people who were parents of children, but did not have a child with a SETBP1 difference. And we ended up excluding those who disclosed that they had a child who had special needs, just because we didn't want to muddy the waters any with our data analysis. One thing that is really interesting is this kind of description of the community. You can see that only 4 participants disclosed that their highest educational level was high school. So this kind of highlights what has been a common theme in conversations over the last few days, that there's still a need to get more people tested. So we really think that this speaks to the likelihood that there are some parents who don't have the social capital or the economic capital to kind of push through and get things handled right for their kids and get them on our radar. So that's something that we're very eager to pursue. The participant language is varied. As everybody else has mentioned, it's very definitely biased towards English, but we were able to get some folks to participate in other languages. So we appreciated that very much. So I want to kind of slide through these. We're using the same presentation we did for the researchers, and Haley told me, you get excited about stats. Nobody else gets excited about stats. So yes, ma'am. We won't talk about the stats. So what we did find on the parental stress scale, one that was just previous, we kind of expected, just kind of anecdotally, that parents of kiddos in the SETBP1 community would experience higher levels of parental stress than those who weren't. And that is not what we found. There was not a difference, right? So what we've kind of been talking about, and conversations with you guys have helped us to flesh this out, is we're thinking that it is more of a sense of new normal, right? That whenever you complete this, I'm not stressed for me, but probably your overall level of stress is higher, right? So we're going to dig into that a little bit deeper and see where we can kind of find where we're missing. We also conducted the parental sense of competence scale. And what was really interesting here is that there was no difference in how satisfied you guys were with your parenting experience over those of kiddos who did not belong in the community. But there was a difference in the sense of efficaciousness. So even though the stress was equal, parents of the kids in our community did not feel as competent and able to appropriately parent their kids. Like they felt like they were missing some resources, or maybe not always making the best decisions, right? So that's really interesting, and we're going to continue to dig into that, and we'll give you a little bit more information about what we're going to do. We also looked at the ways of coping checklist, and just go forward to the next one, Haley. So one more. What we found here is that parents who were in our comparison group, who were not in this community, used more dysfunctional ways of coping, more maladaptive ways of coping than you guys. So I think that really, I mean, give yourself a pat on the back, right? Like, even though you may not always feel like you have it all together and you know what you're doing, y'all are making more healthy decisions in terms of parenting resources and skills than other people are. And I think that speaks to who you are as a group. And I also think it may speak to that disparity again in people who have the resources to pursue genetic testing and things like that. So we do need to look at those features of our comparison group a little bit more closely as we move forward. So this is just kind of the summary. We want to look at where exactly parents are not feeling efficacious. Go forward. All right, and I've already talked about that. So just really briefly in the qualitative analysis, the main challenge that we identified from those open-ended questions were concerns about cognition. So to that end, the main thing that we're doing at this conference is kicking off the cognitive testing that some of you guys have already participated in, and then we'll be sending things out in the coming weeks to follow up on that and really try to find out a little bit more about what the phenotype looks from that perspective. And we did find the same things that we've been hearing through all the presentations. People describe their kids as affectionate, social and friendly, happy, and those were the really big common characteristics. Is there anything you'd like to see emerge from the research project? What we heard was education, support, and awareness. So that is where Dr. Robertson is going to fill in on our future plans. And then we'll skip through this language analysis. I do stuff with words and numbers, and you probably don't want to hear about that. If you're into it, come find me at lunch and we'll talk about it. So I'm going to pass it over to Stephanie.
So just to kind of summarize and to wrap up, the things that emerged are people are interested in learning a little bit more about what the cognitive profile looks like for kids with SETBP1. We're initiating that process this year, and we'll kind of see where the data leads us in terms of additional cognitive testing. So the cognitive testing that we're doing now is a sort of a brief snapshot looking at disparities between verbal and nonverbal for those kids who are verbal, if we can gather that information. But we're also looking at other sources of information, maybe trying to develop a better understanding of some of the characteristics of hyperactivity, impulsivity. We're going to dig a little bit deeper into that. We're looking at digging a little bit deeper into some other forms of behavioral things that we're seeing, questions about autism, sort of what are the impairments that or the difficulties that some kids are exhibiting. Are we seeing patterns in the data? So basically what we're trying to do is identify patterns, identify what it looks like to be a child with SETBP1 HD. And so we're going to be able to develop that information and maybe develop advocacy resources as well. I work with a lot of families in schools who are struggling with how to advocate for their children during their IEP team meetings, those kinds of things. And so we're looking at developing resources for that as well. And also are open to other avenues for research. So as a community, if you identify other needs, please communicate those things to Haley, as she is a part of our research team and she can help to guide and shape the research as needed. So that is it for our presentation, and we will do a rapid change and get the next people up.